All right, my name is Jennifer Pierre. I'm a nurse practitioner student at Maryville University. This is my ID. All right, I'm going to be doing my cardiac and respiratory assessment today, and we're just going to do a 360 of the room before we get started. All right, the first thing I'm going to do with my patient is inspect his chest and his skin. Make sure he's not using any accessory muscles or any nasal flaring going on, which would indicate respiratory distress. Looking for any venous patterns. I'm going to check the AP diameter and compare it to the lateral diameter of his chest and make sure that the lateral diameter is greater than the AP diameter, because that's how it should be. I'm also going to palpate his chest area for any crepitus, which is like a crunching noise that would mean that there's air in the subcutaneous tissue. I'm also going to inspect for landmarks as well. Okay, the trachea and the sternal notch, the angle of Louis, the costal angle right below the ribs. Sorry. And then I'm going to have you put your neck back a little bit and just looking at the vertebrae, the T1 and the C7, okay, and they're intact. All right, so now I'm going to have my patient turn to the side here, and I'm going to look at the assess the thoracic expansion. So I'm going to have my patient take a deep breath. Okay, and with the thoracic expansion, I'm waiting. I'm looking to see that my thumbs are coming apart symmetrically, and they did. The next thing that I'm going to do is percuss for diaphragmatic excursion. So I'm going to have my patient put his arms across his chest and just lean forward just a little bit. Take a couple of deep breaths, and your last breath, hold it. Inhale. Okay, good. Okay, you can breathe normally. Okay, now I'm going to have you take a couple of deep breaths, exhale and hold it. Okay. All right. All right, and for that, I'm just going to measure that. And the normal is 3 to 5 centimeters. And this right here is about 5 centimeters. Okay, and that's good. So the next thing I'm going to do is just percuss the thoracic area. Just looking for any unusual dull areas, which we should have. I'm going to percuss the front. Oh. Put your arms up across your chest. Okay, looks good. All right, so, and I didn't hear any dull areas that weren't supposed to be there. Next, I'm going to auscultate starting in the front. Take a deep. Nice, slow, deep breath. Okay. Okay. All right, next, look at the back. Take a deep breath. All right, and with the lung sounds, I'm just listening for any crackles or any abnormal breath sounds anywhere. Next, we're going to move over to the bed, and we're going to work on the cardiac assessment. All right, so with this, again, I'm going to inspect my patient, looking at his lips for pallor, just like I kind of did over there. In this case, I'm going to also look at his ankles, make sure that he has no edema, because that could be indicative of cardiac issues. I'm going to palpate the pericardium for any lifts or heaves, the left sternal border. Left sternal border, if there's lifts or heaves there, usually that's indicative of right ventricular hypertrophy. The apex, and then the base. I'm going to have my patient turn to the left-hand side. I'm going to palpate again the pericardium, the left sternal border, the apex, and the base. If there's lifts or heaves at the apex, that would indicate left ventricular hypertrophy. All right, the next thing I'm going to do with my patient is listen to his heart. Okay, the second intercostal space, right sternal border is the aortic area. Pulmonic area, left sternal border, second intercostal space. Third intercostal space, left sternal border is Erb's point. And that's the atrioventricular valves. Fourth intercostal space is the tricuspid area. And then the mitral area, fifth intercostal space, midclavicular line. All right. Next, I'm just going to palpate here for that PMI, the point of maximal impulse. And I do feel the heart beat there. Okay, I'm going to have my patient sit up. All right, and I'm just going to listen to his chest again. And this brings the heart closer to the chest wall. Pulmonic area, Erb's point, tricuspid area, and mitral area. Okay, all right, and that's the end of my cardiac respiratory assessment.